a big deal? Well, probably most of our research has been, we've done some in the GI tract. The immune system is a big deal for us. And it's a big deal for our kids with spectrum issues, and because allergy and asthma is an immune system problem. That's what it is. And when it happens in your lungs, that's asthma. When it happens in your brain, it's autism and OCD and Alzheimer's and things like that. Okay? A's and D's, right? All these different letters in there. Okay? Metabolism, that's what you do with what comes inside you. Air, water, food, changes around, spectacular body chemistry, the living chemistry, that's metabolism. And then part of that is detoxification. And so we take things that are not good for us and we either throw them out or destroy them or cover them up, and then they're not as harmful. And a lot of our kids don't do a good job with that, and a lot of the adults don't do a good job with it that we see that are autism. These things gang up on your brain and your intestines and your immune system altogether. It just doesn't work right. So then we get all these symptoms that are behavioral. So when someone does this, a lot of the people do that, a lot of the kids in the office will do it. They look away, but they turn their eyes toward that. The lateral gaze phenomenon. And so Mary Makes in Richmond, Virginia, did work on that with vitamin A, and for the physicians in the audience know about these gated pool receptors, and vitamin A in the brain, and right brain, left brain, conjugate vision, and all these complex things the eye doctors talk about. If anybody acts up out of it, I'm going to shine this laser in the eye. I don't think we have any gorilla. Never had to do that yet. So this all gangs up and makes medical things happen. So when your foot doesn't work, you live. When your liver doesn't work, you get jaundice. When your brain doesn't work, you don't talk right, you don't have to say to somebody else. So we live in a society where we're prejudicial. I'm just going to say it. I'm an angry parent, just like a lot of people. That when your brain doesn't work right, people are prejudicial to you. Oh, you need to just fuck up and just discipline. They just need to learn to discipline themselves. They just need to sit still. Well, for some of our kids, sitting still for a half-hour dinner table is like if I said, why don't you come over for dinner? We're going to sit down for 12 hours. Don't move your feet off the floor. Okay? All right? Keep looking in this direction. You know? What are you shifting around? What are you doing it for? What did you do this for? Why did you do that? Don't do that. Don't touch that. Don't breathe. Our kids feel like they have to do some of those things. Okay? So these are manifestations physically. Sensory integration. Kara Ware's son wouldn't want anything to touch his skin when he was younger and sicker. And if I said, oh, here's your clothes for today, they're hot sandpaper, molten red hot sandpaper, go put it up. You wouldn't do it. You can't. He couldn't do that. It was painful for him to do that. Right? So the cerebellum, that's balance. Some of our kids have this craving for balance. My son gets on top of the 20-foot swing set at the block party, and he's up there, and all the men drop what they're doing. They drop their beers, they drop their hot dogs, and they run over there, and I just moseyed up there real slowly because they have perfect balance. And everyone's having a heart attack except me. And he's just seen the Olympics, so he just went like this. On some beam that was this wide, and he craved that sensory input for them. And he wants to be spun around on the jerky, roller coasters at the amusement park. And I'm throwing up and I need a vomit bag. He wants to do that because he craves that input. Okay? And so it's just different for them. Their bodies work differently. It's not a medical issue in the mind of most doctors, unfortunately. And the doctors and nurses here can tell you we're not trained that way. But unfortunately, they don't train us that way. We unfortunately get brainwashed to thinking that we know we can look at somebody and tell if it's medical or mental. That's not easy to tell. That's why there are tests.